Fatty liver disease is a condition where there is too much fat in the liver. This excess fat can interfere with the liver's ability to function properly, leading to a range of health issues. Our liver is an amazing organ, working hard to clean our blood and produce substances that help with digestion and energy. It also stores vitamins and minerals and helps regulate our metabolism. However, when fat builds up, it can lead to inflammation and damage. This inflammation can cause scarring, known as fibrosis, and if left untreated, it can progress to cirrhosis, a severe liver condition. There are two main types of fatty liver disease: non-alcoholic fatty liver disease, or NAFLD, and alcoholic fatty liver disease, or AFLD. Both types can lead to serious health problems if not managed properly. As the name suggests, an AFLD is not caused by excessive alcohol consumption, while AFLD is. An AFLD is often associated with lifestyle factors such as diet and exercise. NAFLD is becoming increasingly common, affecting about 25% of adults globally. This rise is largely due to increasing rates of obesity and sedentary lifestyles. It's often linked to obesity, insulin resistance, and high cholesterol. These conditions can all contribute to the accumulation of fat in the liver. AFLD occurs in people who drink alcohol heavily over a long period. Chronic alcohol consumption can overwhelm the liver's ability to process and break down fats. The more you drink, the greater the risk to your liver. Reducing alcohol intake and maintaining a healthy lifestyle are key steps in preventing and managing fatty liver disease. Non-alcoholic fatty liver disease, or NAFLD, is primarily triggered by a combination of factors like obesity, insulin resistance, where your body doesn't use insulin effectively, and high levels of fats, especially triglycerides, in the blood. These factors create a perfect storm that leads to the accumulation of fat in the liver, causing inflammation and damage over time. These metabolic risk factors are often associated with conditions like type 2 diabetes, metabolic syndrome, and unhealthy lifestyle choices. A diet high in processed foods, sugary drinks, and saturated fats can significantly contribute to the development of NAFLD. Additionally, a lack of physical activity exacerbates these issues, making it harder for the body to manage blood sugar and fat levels effectively. Other risk factors for NAFLD include certain medications that can affect liver function, rapid weight loss which can stress the liver, and conditions like polycystic ovary syndrome, or PCOS. PCOS is a hormonal disorder common among women of reproductive age and is often linked with insulin resistance and obesity, further increasing the risk of fatty liver disease. Alcoholic fatty liver disease, or AFLD as the name suggests, is caused by excessive alcohol consumption over a prolonged period. The liver processes alcohol, and excessive intake can overwhelm its ability to function properly, leading to fat accumulation and liver damage. The amount of alcohol that can lead to AFLD varies from person to person, but generally, men who consume more than 3 drinks per day and women who consume more than 2 drinks per day are at increased risk. It's important to note that even moderate drinking can be harmful if done consistently over many years, highlighting the need for mindful consumption. One of the trickiest aspects of fatty liver disease is that it often doesn't show any symptoms in its early stages. Many people live with the condition for years, completely unaware. However, as the disease progresses, some individuals may experience fatigue, a feeling of fullness or discomfort in the upper right abdomen, loss of appetite, and unexplained weight loss. If you have any of these symptoms, it's crucial to consult your doctor for a proper diagnosis. Remember, early detection is key to managing fatty liver disease effectively. Diagnosing fatty liver disease usually begins with a comprehensive review of your medical history, a thorough physical examination, and a series of blood tests. These initial steps are crucial in identifying any underlying conditions that may contribute to liver issues. Your doctor will ask detailed questions about your alcohol consumption, as well as your diet and exercise habits. These lifestyle factors play a significant role in the development and progression of fatty liver disease. Blood tests can reveal elevated liver enzymes, which are often a sign of liver inflammation or damage. Elevated liver enzymes can be an early indicator that something is wrong with your liver. However, abnormal blood tests alone don't confirm fatty liver disease. They simply suggest that further investigation is needed to pinpoint the exact cause of the liver abnormalities. To get a clearer picture, your doctor may recommend additional tests. Imaging tests are often the next step in the diagnostic process. Imaging tests such as ultrasound, kinetic scan, or MRI can help visualize the liver and detect fat accumulation. These imaging techniques provide detailed images that can reveal the extent of fat deposits in the liver. An ultrasound is often the first imaging test used, but a CT scan or MRI can provide more detailed information if needed. A liver biopsy, which involves taking a small sample of liver tissue for examination under a microscope, is sometimes necessary to confirm the diagnosis. This procedure is considered the gold standard for diagnosing fatty liver disease and determining the severity of the condition. It provides the most accurate information about the extent of liver damage and fat accumulation.